Aloha, no. Welcome to Mel and Charlie live here on Facebook. I'm Uncle Charlie, and that's
And
Uncle Mel.
I guess
Yeah,
I'm Uncle Mel. What the hell? Call me Uncle Mel. Call me whatever you want.
yeah, he's
Call
Uncle
me
Mel,
whatever you
and
want.
we're so happy to have him back. The sad thing is, he had to leave his children. His children, Baron and Nikki girl, had to leave them up there. But you know, like all good parents, we sometimes we gotta cut the apron string. And I know it's hard because Nikki had gotten COVID, but she looks really good. She looks like she made a not a full recovery, but she turned that corner, that difficult corner, which is a good sign. I'm glad. And like I
Yeah.
said, Mel, it's just the hair. Mm, mm.
You know, it's kind of hard to get angry with your daughter when she get COVID, but that was the first question I asked her, and this is no lie. I asked her, "Did the COVID cause your hair to turn red, or did you do this in person? I mean, on purpose?"
Yeah.
And she said, "Dad." I said, "No, I'm just checking, man, because I just would never do that. I would never." I got to meet her boss. Well, not the boss, but the owner of the shop that she leases the space from. And I was telling her, and I said, my daughter's hair. Like, what the heck is this? This what people do? She goes, my daughter's hair is bright blue. Ah, okay. I guess that's how Portland's a different, funky place.
But you know what,
Uh,
Mel? I tell you what, if I could grow a full facial hair like yours, no be surprised I only shave one half and leave the other on growing.
I don't know if you can call this a full. This thing is all this so terrible, but I just lazy shave. It was kind of
Uh,
cold up in Oregon, so it kept my face warm. Kept my face warm. But we had heard all the stories about Oregon, especially Portland. They had their governor lifted the mask mandate right until their hospital started getting full. And we told you to start, but my daughter couldn't get to the hospital because they didn't have room. But since she reinstated the mask mandate, I got to tell you, everybody wears a mask. It was I didn't expect that in Oregon, but it was amazing how many everybody wore a mask in and out, inside and outside. So that was a good thing. We were very careful. Um, we were very careful, even going to the supermarket. Patsy went and did some shopping and at the supermarket for food. These guys ate like kings and queens, and in fact, even before we left, Patsy made meal preps for them. So it was cool. But I mean, it's everyone has a mask. We of course we're paranoid, right? Or I am. Not Patsy, not so much, but uh, we're very careful, very very careful. We got off the plane today. We went straight to the convention hall, got tested. We just got the call at 6, just about 10 minutes ago. We got the call from the state saying that we both were negative. We'll test again um, this weekend. The county will not let anyone go back to work that travels back from the mainland until they get a negative COVID test. You got to. They're doing it. They're recommending, not recommend. They're requiring you to get a test 3 days after you come home before you can go back to work. And it's not paid. You don't get paid. You can use your leave, but it's not paid. It's not administrative leave. And I think Derek, I think, is the only one that's doing that statewide, as far as I know.
no, but is
Um,
that just for county workers?
just county workers. Just
Yeah,
county
but
workers.
not anybody else.
No, no, just the county workers. What he has control over, right? But my point is that that's being responsible. That's being responsible. And so I'll get my test on Sunday. I'll get one on Saturday and Sunday because I'll get the 3 days, and then I'm gonna go get the fourth day. And that's really not so much for going back to work. That's just for me. My mother-in-law is 84 years old. She's vaccinated, but I'm still concerned about her. So, I mean, everybody's got to do that kinds of stuff. I mean, this is just, come on, people. And
Yep.
by the way, we have Dr. Miscovich on tonight. We're going to talk about these ridiculous numbers. We're going to talk about a lot of things tonight. But, condolences out to the family. Kauai's numbers just came out. If you didn't see it yet, I just got the press release. Um, eight we got our eighth fatality today on Kauai. So our prayers and condolences go out to the family. Guys, this is not going to stop. I don't care what the lieutenant governor says. I remember a couple weeks ago he said we're going to start seeing the numbers drop in 2 weeks. Wrong answer. Wrong answer. So we'll have Dr. Miscovich give us an update on what's going on and what's the haps, and he should be on in a few minutes. It's nice to see you, Charlie.
Well, thank you. You know, I wanted to ask your opinion about one thing, and that is, you know, we got again, we still have protesting going on, but those who protest, I'm just curious, what information are they using to validate their positions? I can validate mine that tiny people getting infected and way more people are dying this go around that shouldn't be, but hey, it's happening, right? So I can validate that just by the simple reports. I just, you know, I want to give the benefit of the doubt to those who are protesting, but I just don't find the information validating their stance. That's all. And I don't want to make it, I don't want to make it bad, but I can tell you what, it contributes to the hysteria. If they do protest and they can put out some really good information that's scientifically based, that we know others have gone that route before, yeah, I would encourage them to bring it on. So, you know, because it's all about providing information, right? That's all it is. But I guess, I guess when you start providing information that maybe it sounds good, but has no merit to it, that's when it gets a little dangerous, I guess.
Well,
I wanted your thought there.
yeah, that's a great question, Charlie. As you and I, all of us have family or friends that are against the vaccine. That they believe, based on their research, that the vaccine is not good for you. It's creating more of a spread. And it's interesting you asked that question because I got a question yesterday via messenger. A great friend of mine, one of my best friends, living on Oahu, and sent me a screenshot of a post from a doctor. I forget this doctor's name, talking about how if you had COVID, then it's better for you not to be vaccinated, and whatever it was. And she asked me, Mel, what did you see this and what are your thoughts? Because a friend of mine who I've been trying to get vaccinated forever sent me this and said this is why she's not going to get vaccinated. And this is what was my answer to her, Charlie. And this is what my answer is, because I get a lot of my friends and relatives are sending me messages about, hey, Mel, I know you support the vaccine, but check this out. Check this out. Watch this video. And I do. I watch all the videos and I read all the posts. And I read all these articles. But this is what it comes down to, Charlie, for me. And this is what I sent to my friend. The response was, I read all that I get. I watch all the videos that I get that are sent to me because I too want to learn. And Charlie, you know me well enough to know that if I came across some scientific data or some expert data that I believe was accurate and I could trust the source, I have no problem coming on the show and saying, hey, guys, you know what I found out? Blah, blah, blah. I wouldn't have a problem with that. I have absolutely no problem. For those of you that know me and followed me on the council, on my council career, you know that I had no problem coming on and said, 3 weeks ago I misspoke. I was relying on information that wasn't accurate. And that's, for me, it's not a big issue. It is a big issue for our state leaders, for the lieutenant governor and the governor. They will never do that. But I told my friend this. I said, hey, I rely on experts that I have a personal relationship with. I rely on experts like Dr. Miscovich, like Dr. Jerome Kim, like Dr. Capono, like Dr. O'Carroll, like Dr. Lee Evslin, like Dr. Lee Altenberg. These people, Charlie, we've developed a personal relationship to a point where we trust them. Dr. DeWorkin, sorry, Jonathan. But we have a personal relationship with them. I don't know who the hell is this guy from YouTube who claims to be an emergency room doctor someplace. or claims to be an infectious disease doctor someplace. I don't know them. What they read, what they post and what they put in a video, for me, I'm sorry. I don't have that level of trust. I don't know them. So of course I'm gonna trust the person that I know. Now I know my friends will say, oh Mel, these guys are all in cahoots. Well, whatever. All the people that are against vaccination in cahoots. Listen, like I said before, Charlie, and we make this a point every single show. Everybody has their right to choose what they want to choose. But for me, I am going to listen to the doctors and the experts that we have, Charlie, developed a relationship with, and you get to trust them, right? I mean, I have my own doctor. I have a personal doctor. We all do. Most of us do. Now, am I going to listen to my doctor or Dr. Miscovich guys, or am I going to pull off some Dr. Kilimanjaro from YouTube, from the Google University? So anyway, hope I answered your question, Charlie.
Well, thank you. Thank you very much. And I'm sorry I didn't greet you today. I heard that you were somewhere in the vicinity of the Lihue airport when you arrived. I was taking care of, I had several meetings today. So I just want to say welcome home. Thank you for that answer. Today was kind of and there's our good friend, Dr. Miscovich. But today I had this fortunate situation. I had a gentleman who arrived a week ago. He had everything by the books. He had his vaccination cards. He had his pre-test. Perfect, perfect, perfect. He stayed in Hawaii for more than a week, and now he's on Kauai for about a month. But he just wasn't feeling good, and he walked out of the plane and wasn't feeling good. So they called, and he had a slight temperature. But the good thing about it, and all the professionals on Kauai, went into our protocol, making sure that we got to make sure that fever, that slight fever, and I'm saying it wasn't a high fever, but that slight fever was a little concerning. But he got tested. He got tested today and got the news back that he was negative, but that he just wasn't feeling that great. But that also he hadn't eaten all day, so he was a little weak. But he did good. But I just want to give a shout out to to our friends from AMR. I want to give a shout out to the fire personnel at the Lihue Fire Station, the airport, the ARF personnel. Great people. And I also want to say thank you to the National Guard. So, folks, if you don't know why they're there for everyone's protection. And I just want to say thank you. They did an outstanding job today. And I'm proud to say I get to work with them. But yet we are seeing the numbers drop. They talked about numbers at one time, Kauai having close to 5,000 visitors a day. Now it's dropped down considerably, down to about 2,000. So I mean 3,000. So I see the numbers kind of tapering off a little, and it could be because of the announcement of, all of these things. There's cancellations going on, but you know what, folks? We were told way in the beginning that it's going to take about a year to 2 years for tourism to bounce back. Well, let me tell you, something happened. It went rapid fire, and they went straight for the moon. They went straight for the gusto. So they've done it once, they'll do it again. But I think we need to scale back a little so our Aina, our land that we call home, can get a little time to recuperate and get a breather. Put it that way. That's what we need.
Charlie,
Yes, sir.
can I ask you a question?
Yes, sir.
Do you know what kind of test he had?
That part I don't know. I wasn't in the vicinity.
Because my medical brain, do you know how long it took for that test to come back?
It took a couple hours while he was isolated.
Okay. Yeah, because my medical brain would go, okay, what was the test? What was the quality of the test? What was the accuracy? And does he need to have a repeat test in the next day or in the next 3 days to guarantee that he was not a false negative test and that he converts? Right.
I believe he will do it under the setup that we have here. But it was good to know that and this gentleman was a perfect gentleman. He understood the rules and he was very, very cooperative. And you know, Doc, it's not often that working at the airport will get cooperative individuals. I mean, look now, we got people, and I mean, that's how stupid they are. You're gonna fake a vaccine card, at least spell the damn word Moderna right, right?
That's
What
crazy.
a knuckle brain. What a knuckle brain.
Yeah,
So
they should get an extra fine for the illegal spelling. So, for God's sake, for being, foolish, that's just ridiculous. But it does bring up the question that all of us are talking about. You guys are talking about is how many are out there? How many do we have coming through? Right? Do we know? Do we know how many are coming through? And it begs it begs the question, which is being floated around now, that one of the things we need to do is relook at safe travel and reinstitute some form of testing that will be broad testing that will be available, and vaccinated or not vaccinated. If you ask me from a medical perspective, everybody needs to be tested because the breakthroughs are outrageous. The number of breakthroughs are really increasing. And again, I want to highlight, get vaccinated, totally believe in vaccinations. You will live. You will not die. You will have a period of 4 to 5 days where you can shed the virus. But, and you may get mild symptoms, as you see in our state right now. We have 12.5% of those in the hospital are vaccinated breakthroughs. But relative to the total number of people vaccinated, 1 million or something, it's manini. And then the next thing I can tell you is the safe travel program and reinstituting testing will, in my mind, bring another layer of people who will want to come to our state because we're going to be a safe state, right? That's where they're going to want to come. And I'm sorry, but I don't buy anything anywhere that says that we're not allowed to test people.
Yeah.
Nowhere do I see that. And, I'd be real interested to know, to get whoever the official is who's saying that, and not just say, well, maybe, but I think we need to see why. So.
Well, before we go on, I would like to say to one of our viewers tonight, yes, I did not get the memo about wearing a black shirt. One, we have our models, Dr. Scott Miscovich and Mel. They look good in black. I can tell you, I wear a black shirt, I look like a giant walrus. So that's why I'm not wearing any black.
No, wait. Isn't black thinning? Black makes you look thin and skinny, man.
Absolutely.
Right.
That's why we're black.
I mean, what school did you come from that says that I wore black before and I performed on stage and I look like one big doorstop on stage holding on bass? I said, never again. I go with black.
Oh, it's okay.
Doc, thanks for joining us tonight again. It's always great to have you on, and I want to personally thank you again. When I had some questions about my daughter, I shotgunned all of our guests that I felt we trusted. We just had a little discussion about that, and of course you were one of them. And I will say this: all of the doctors that I shotgunned the same question to, all responded with the same answer. So what does that tell you, folks? These guys don't work together. They don't butter each other's bread. No, man. They just all follow science. And thank you, Doc. My daughter did get her vaccine shot. 0, except for the sore arm. Absolutely no side effects. 0, nothing. So,
nice.
So it's awesome.
Nice.
So, anyway,
hey,
thanks for that. Personally, just a personal thank you.
It's a nice segue into some of the science because, I get asked all the time, which vaccine should I get? And I think you guys heard me say earlier, we've been doing this so often, I was kind of leaning on Pfizer, but nah. You may see dogs and cats flying around because it's an active time now. They're all in their active mode. So, but anyways, I think some of the new data coming out has pushed Moderna over the top as the number one choice. So if you can get a choice, now again, they're all fine. They're all going to protect you. They're all going to stop you from dying. We're talking about mincing the science as it comes out. And one of the new data points that came out, a very well done study, shows that the amount of antibody in your body is almost double with the Moderna over time versus Pfizer. It's not the pure answer because remember, there's about 5 different types of antibodies that are made when you go through the immunization, but only one major one is regularly tested by regular methods. The others, a lot of the science, when the research institutions do test them, are showing some of the memory cells, some of the bigger cells that are in there, kind of lurking in the back, are still very significant as we move on with the through the past the 6-month mark or 8-month mark. And yet at the same time, we are seeing both of the Pfizer and Moderna's, the stats are about 65% effective in prevention. So there is decline, which is why we're getting boosters, right? Starting next month, we get a booster, and that's just the way it's going to be. And then a lot of question will be, well, how much immunity are we going to get after the booster? Well, we know it's going to be significant. It's going to be a lot more. The main groups of people, just because for all those people who are a little bit wigging out saying, oh my God, am I going to have problems? Am I going to have side effects? The general studies are now showing that the side effects are slightly less than your second shot. They're not more, they're less. You can almost see that the side effects are generally about the same as you would see, but they're overall now, as we're getting our data coming back, it's less. And it's going to be the same shot, same. It's just a third shot. We call it a booster because we're trying to boost the immunity, but everybody's asking me that also. Is it half dose, new dose? Is it a different one? No, it's same shot. So I will say, everybody keep looking. There's some data that's coming out tomorrow. The next day, there's going to be more push by the FDA. They're doing some investigative panels over the next 2 days from outside experts. But we will be getting boosters. Boosters will be broadly available. I can already tell you, I can't wait to get one. I'm going to be lining up because I'm coming up on my 8-month mark, and just want to be safe. And because I'm out there exposed all the time, and I really, really hope that there is some type of push to allow our frontline hospital workers, first responders, anybody in high contact, please should be able to get it, as well as our kapuna. We're getting quite a bit of breakthrough in the nursing homes, so we need to get the kapuna vaccinated right away. So almost a repeat of where we started, but it's going to come up.
Mm-hmm. Doc, I read somewhere that the Johnson & Johnson studies, the booster studies, are very positive as well, that after the booster for Johnson & Johnson, the immunity is going to be significantly higher with their booster when it becomes available. So that gets me excited because I got the Johnson & Johnson because I went with the one-shot deal. I regretted that because I think, we've been better off getting Pfizer and Moderna, but I mean, it is what it is. But that's what I heard, that the booster will be, so that's good news for the.
I guess the bottom line is you get, like whatever is available, you get it.
Yeah.
That's the bottom line. I mean, if none available and you only got the Tennessee whiskey, you go for it.
Oh, that's the only thing available. Remember, Charlie, when Dr. Jerome Kim was on our show the very first time, we was talking about vaccines. Dr. Jerome Kim, world renowned. This guy is incredible. By the way, he will be on our show on Friday night. So nice. I'll post it up. Yeah. But remember that somebody from the viewer, one of the viewers asked the question, which one should we get? And Charlie, what was his answer?
Whatever is available.
He
Whatever
said,
is
whichever one you
available.
can.
Yeah.
Yeah, whichever one you can, go for it.
Real
Yeah.
quick, and this was going again, Doc. We talked about the state continuously saying we cannot do testing because of the CDC said we cannot because they said it's safe to fly if you're vaccinated. Blah blah blah, and we clarified that based on the CDC website. But Laurel Kenny just posted this, and thank you, Laurel, for sharing this. But this was updated on August 25th on the CDC website. It says state, local, and territorial governments may have travel restrictions in place, including testing requirements, stay-at-home orders, and quarantine requirements upon travel. For up-to-date information and travel guidance, check the state or territorial and local health department where you are going. So that argument is gone. And the lieutenant governor needs to put that to rest. I think he got the hint because he's not talking about that anymore. What I'm finding, Doc, there is absolutely no discussion. You notice, like even with the increase in numbers, the Labor Day weekend, and this is kind of where I'm heading to, talking about the 72-hour lockdown or stay at home or whatever. But there is no mention, except from people like you and everyone else, the experts, but no one else in our leadership is talking about bringing back the testing. The pre-travel, post-travel, none of that. They stay completely away. All of the attention is focused on the local gatherings, which is true. We got some knuckleheads. They just had another big one. BYU University students had a big party last night or night before last. We had a big one the other night. So we know we got some issues locally, but also we have some problems with visitors coming in, or travelers, I should say. So what are we not getting at the leadership level? What are we not getting that we just completely stay away from the travelers?
Yeah, no, I strongly feel that that there's far more infection in the travelers than is being identified, and let's talk some reality. Average length of stay in our state is what, 5 to 7 days, right? Depends and it varies, but generally 5 to 7 days. So you're coming here. You've dedicated a lot of time, effort, and money to come here, and we have the vaccinated and unvaccinated. And the bottom line is, if you're positive, you're going to have to quarantine. You're not going to be able to hop back in a plane. You're not going to swim back. And you're going to be stuck here for 10, 14 days. Realistically, is anybody going to do that voluntarily? Or are you going to say, it's just a stuffy nose. I'll deal with it. I'll get tested when I get home. And I'm not calling everybody, evil or anything like that. I'm just talking human nature. You're coming, you have a trip, you're planned. And if you start getting symptomatic, whether you're vaccinated or unvaccinated, unless you're really, really not feeling good, I have a feeling you're waiting until you get home before you get tested. I would love to see a study of post Hawaii, the number of people that are positive after they get back, because the other thing is we have a high positivity here. Are they contracting it from us, right? Who knows? Mm-hmm. But I think, to basically just state the data is not talking about the reality of COVID, the reality of human nature, and the reality of what we are likely dealing with. Okay, so let me throw this out to you. We'll have a vote of 3 and then everybody can vote. Do you think that the number of visitors that we're seeing in this data, we're being told it's 2% or something, do you think the number is lower, actually 2%, or higher? What is the highest likelihood that that number represents? Is that a great factual number, when it comes to the reality, or do you think there's a better chance it's higher? Yeah,
it's higher.
I would bet my house that it's higher, and I really would. I really would. And I know that what they're saying is 2% of the infections or the people in the hospital are visitors. That could
No,
be right.
I tell you,
But
I
but
tell you,
but
I tell you what the problem is, I'm looking at it from someone who's there just, non-scientific, just watch as people come through. It's the way the information is gathered. They walk up, they go to an iPad, they scan the iPad, that's it, out the door. Because when they uploaded their information and when they got that negative test, it only reflects at that given moment in time. That's when they were negative. It doesn't say anything forward. So if I took the test 72 hours prior to traveling, from the 72nd hour counting down to takeoff time, did I stay locked up so I didn't come in contact with anybody? No, probably not.
Exactly.
Once I get to the airport, don't I mingle with people? Yes. So that's the question. That's the question. So this tunnel that all travelers coming to Hawaii, when they get to an airport, right? They're mixing in with people that's not coming to Hawaii, that doesn't have to be down this tunnel. Doesn't have to be strict restrictions. So they got this cross mixing going on. So when that information was uploaded, it was only uploaded at that given time in this universe that they were negative. It doesn't say anything past that.
Exactly.
And that's the danger. That's the danger.
Yeah, exactly.
listen, what is the positivity rate?
For what?
8% for the state of Hawaii.
Well, today we again have a partial number. Realistically, when you dive it out, it's close to 10%.
Yeah. Okay. So
Yeah.
let's just say 10%, because they do like a 14-day average, right? And then they miscount, so the numbers drop. So you don't even, the data we get is inaccurate, and they're basing their and I said it today, their non-decisions. Yeah, they're basing their actions or inactions on a faulty number. But let's just say 30,000 people a day come in, and there is a 10% positivity rating. If you tested everybody on that flight, everybody got tested. Let's just assume everyone got tested. You think we would have 300 cases a day, 400 cases a day? That freaking airplane with 200 people, you get 20 people just in that plane. You get 30,000 people a day. That's 3,000 people a day. So I mean, that's it's just, generally speaking, to believe that it's only a small percentage of visitors that are positive. I think it's just plain ignorance and stupidity. Really, just even if you went to 5%, let's just give them the benefit of the doubt and say, you know what, let's just go 5%. Think about the cases on a 30,000 passenger a day arrival. Times that by 5%. You're still talking about a ton of people. So, yeah, no, Doc, I bet my house is higher.
Yeah.
And again, anybody can spin the numbers. They can cook the books. They can use the data that makes their agenda move forward. And that's what they do on a constant daily basis.
Hey, Doc, let me ask you something real quickly.
Yeah.
Why do you think the state fears transparency? What are they fearing by not, we're talking about doing the testing. What are they fearing? I mean, I heard two people talking the hotel industry, right? Visitor industry. They said that, oh, this is really going to hurt us. I mean, okay, well, yeah, we see a lot of people getting sick. We see our medical facilities getting overrun. All we're asking for is a little breathing room, right? What is it that you think why the state doesn't want to be transparent about this whole deal?
You can take me down. Well, you're going to take me down to my 3 times a day talks with Harry. Big Island Mayor Harry and I talk all the time, and this is one every day we go through and say, who is advising the governor? Where is the governor getting this information to make these decisions? Because, realistically, Josh talks very nice, but and talks in his own way, but I don't think there's a whole bunch of communication with him and the governor. I don't think he's kind of inside. He's not inside the circle, and the governor's got a little silo, and that's the way he's always worked. And then, I have one fairly, just watching her and talking to the people that I know, that Libby's the real deal. She's a doctor, dedicated, and she's her public appearances are very clear that she's really concerned. She's really concerned. I mean, you can see the verbiage that she uses and what she says. And so I don't think it's that she's sitting there and saying, oh yeah, just open up and, keep on doing what we're doing. Everything's going to be fine. I mean, she said the place is on fire, we're critical, etc. He's not having cabinet.
Is she being muzzled? Do you think is she being
absolutely. That was part and parcel of being in that job, is that you'll speak when spoken to, and you'll speak the party line. I think that's very clear in the way this administration has worked. And so, there is a person who does not get enough attention, who I've had plenty of dealings with, and that's Linda Chu Takayama, his chief of staff, right? And Linda is very, very tied in with business community, very, very, very more from the big business side versus the people side. And I've had plenty of run-ins. He's not having cabinet meetings. So who's advising the governor? So I would like to see this. I would love, under a sunshine law, to have one of a civil beat or someone asked to see his calendar, his agenda. Who's he meeting with? And
Mel, haven't we been down this path he's talking about with the sunshine? Haven't we been down there? And what was the response you got, Mel?
Yeah. Actually, I asked to see. I wanted the roll call of all the people on all of his advisory committees. I don't care, formal, informal. But at the time, he had suspended the open record law, the entire open records law. But about a month ago, maybe 3 weeks ago, I got a letter. I got an email from the State Office of Information Practices, and they said that they are now back open. And if I was still interested in my information, I said, absolutely. So I'm still waiting. That, believe me, that will be made public once I get it.
Yeah, right.
And if I don't get it, I will sue. I can promise you that.
Good.
Because, and this is why. And remember, in Blangiardi, they're all in the same boat, right, with business. But when Blangiardi talked about his new policy in Honolulu about the vaccine requirement, all that stuff, when he was being asked by the media questions, he constantly said, we have been meeting with the restaurant representatives. We have with the business representatives. Not once did I hear him say, we've been meeting with the medical experts, the medical community. We've been meeting with doctors and infectious disease people. No, it's clear. It's business driven, and it's a tough balance to have to put out. But at the end of the day, the priority should be health and safety.
Well, I agree. The same questions should be queried to the mayor and all the mayors. But then I will go back to the governor. So you have that. And then that's the next question is, who are the medical people? And don't just say, well, the director of health, right? Let's get a little bit more. Who else is the governor meeting with? How often does he meet? Now, here's something that I want to see. All right, follow me on this. I'm assuming this is a pandemic. This is a crisis. And I am guessing that the mayor or the governor is getting a briefing of a status update that is somewhere in writing every day, right? Wouldn't you assume that there's got to be a briefing that's there somewhere? And in that briefing would probably be the summary of the events that happened from the day before. I don't think it's a picture of Josh's whiteboard, but it's, it's something that's going to be summarizing what's going on. And I'm guessing it should have the summary of like today's tragedy of 13 deaths and the hospitalizations, et cetera. And now this comes from my discussions with an amazing mentor who knows emergency preparedness, and that's Harry. And as a head of somebody who's in a crisis management, there's got to be projections, right? You've got to understand, where are we going? You have to have all these intelligent people around you telling you, we're here now, and this is what the next day and the next day and the next week and the next month are going to bring. So then you, as the leader who has the ultimate decision, can make a decision, right? There's got to be a piece of data. Now, this is my question. How many deaths are on that? How many deaths are projected? How many on that piece of paper, if it does exist? Because I said it on this show, Tim Brown said it on this show 3 weeks ago or 4 weeks ago, that we are going to start exceeding 10 and 12 deaths on different days. Because you know what? It's science. The University of Hawaii's, his own university and his own group, that what is it? The high
PAM or HIMAP.
Yeah, right. They produced another group of incredible data. Again, 25 people came together through his own universities. Did he ever once comment on that? That unbelievably dark and sullen news that was projecting just, increases, the same increases that we actually saw come true, that Tim Brown called, and they called, and I called, and other people called who have been studying this. And they also called deaths that were happening and deaths that will happen. We know that there will be increasing numbers and continuing to be increasing numbers. So so I say, what is the acceptance? What is the acceptable number where you're saying, you're being handed a piece of paper and saying the people that count on you will die? What's your plan? Just hope? Because right now, that's what the plan is. The plan is, oh, please don't come. Please don't gather on Labor Day. Please, and hope doesn't give any consolation to those people who lost loved ones. 30-year-old, 40-year-old, 250-year-old, 60-year-old, 70-year-old, 80-year-old, 50, 60, 70 on Maui. Those are Hawaii residents. And don't tell me vaccinated or unvaccinated. There are neighbors, there are friends, and who knows why they're not vaccinated. We don't know that. And we need to stop that segregation, that we have two states, the vaccinated part of the unvaccinated state. We're all Americans, we're all Hawaiians, we all deserve to live. And a decision is being made downtown Honolulu to let people die. I'm sorry. That's all I can say. And I'm sorry to get this off my chest. I wake up in the middle of the night thinking this, and I just can't my conscience can't understand how someone, as a physician, we try to save every life every time. How can someone make a decision like that with no plan? I'm sorry, guys, I'm ranting, but I had to get that off my chest, man.
That's good. Hope is not a strategy. Hope is not a strategy. And I think, we've been saying, not just us, I mean, many, I read all the posts, and it's not just our viewers. Star Advertiser, whenever they do their spotlight, these are viewers from around the state, have no idea who our show is. They're asking, hey, what is the acceptable number, Governor? What is your acceptable number of death? Really? And it there apparently there is none. They're just going to let this thing ride, and whatever happens, happens. You know, the weak will die, the strong will survive, and I have a problem with that. I said Charlie and I, same thing. You know, come from our background. We're not doctors, but cops. You know, you're not going to sit back and wait till the shit falls and then go clean up the mess. No, that's what they're doing, and it's wrong. It's damn
Remember?
wrong, and I don't understand it. I mean, I don't. I don't. We're
Remember?
monitoring. Certainly, we're monitoring. Certainly, we're monitoring. Monitoring. What's up, Charlie? I'm not going to stop because I'm going to say the F word pretty soon.
No. You're not going to say the F word. Because I'm going to say it. No. No. It's you remember early on in the game, I came on and I kept on asking everyone. And they made me feel like I was a bumbling idiot. I said, what would trigger anything that happens? What thresholds need to be crossed before something happens, before we do something? Remember that? That was during Bruce Anderson's time. And I said over and over again, and I said, you mark my words, as time moves on into the future, that question will follow everybody, because that's the question being asked right now, right? And it always seems like this administration is always moving the goalposts. As we're marching down the field, the goalposts like, hey, we got 10 more yards to go. Yeah, but they moved it down another 30 more yards. That's why we are where we are right now. And so that's why I asked Mel, I asked the doctor question. Why are they so afraid of transparency? You said something that was very interesting, Doc. Yes, you're absolutely right. Vaccinated or unvaccinated, to me, it doesn't matter. Why? Once a person gets sick and they pass away from this dreaded disease, they passed away. We got to do something about it. To me, I think when we start discussing about vaccinated and unvaccinated, we're kind of like doing the sleight of hands now. Even though it's important to a certain extent, we want people to get vaccinated. But I'm calling out the state and say, please, you guys have been quiet. You folks have been given a free pass all this time. You've been quiet way too long. You gotta say something. You know, if you're gonna quell the Indians, right? If you're gonna quell the natives and give hope and promise to everybody who lives in this state, you gotta say something. You can't think that it's gonna run by remote control. And that's the problem.
Yeah.
That's the problem.
Let me throw something out to you. Have you ever heard this? I'm just gonna tell you something. I've been fortunate. I've been a leader most of my life in different medical organizations and my own companies, and I've worked for a Fortune 100 medical company as the chief medical officer, et cetera. And you guys have been around the block and see it, but you know, one of the keys with accepting leadership is the buck stops with you. That's it. There's no one, unless you're going to try to at nighttime pray to God and ask why it happened. But a true leader is going to not be passing the blame. So have you heard from any of our leaders for them to look right in that camera and say, I'm sorry, we failed you. I'm sorry this is happening right now. Because you know what? Right now, instead of always within, and this drives me up a freaking wall, and I had to stop the F there. It drives me up a wall because anytime we hear anyone on any island get talked about it, and they are asking about, what do you think about the surge? What do you think about the numbers? What do you think about how high things are? Within the second half of the sentence, they're talking about, oh, but they didn't get vaccinated. They're always just going right back and say, oh, but they didn't get vaccinated. Well, you know what? I'm involved with vaccination programs across the United States. And let me tell some of our leaders, look in the mirror. Because you know what? We didn't have a good vaccine program. We did not have a good vaccine rollout program. Not at all. And
Mhm.
let's start taking some responsibility, because what we did is the same mistake that a lot of states did. They did that. You pop it up, you make the vaccines available for the affluent. You got your big old BMW or your nice car, and you can drive into a place, or you are close to a pharmacy, and you understand, and you can feel comfortable going into a pharmacy or something and getting it, and go through the hospital drive through. That's bread and butter. That's going on all over the United States. That's the standard that failed right there, right there. That is the what do you have to do? You take it to the people. You go to, and we should have started with the at-risk people. Yeah, we did the Kapuna, but once again, here we are, state of Hawaii. It's been going on since the 1800s. Been going on. I saw that sad post that had the quote from Queen Liliuokalani, who showed that once smallpox was introduced by visitors, the Hawaiian population went from 700,000 down to sub 100,000 because of disease. Our population and the Native Hawaiian population, and now the Pacific Island population, and then our Filipino population, they're the ones that are being left out. And again, I'm out on the front lines, and I talk to my staff, and the good Dr. Akiona, who's such a superstar with our teams over there in the Big Island, is out there talking to the people, and we go back again and again and again to these same communities, and we reach out to the community leaders. We're reaching out to the churches. We're reaching out to the Marshallese leaders and the Native Hawaiian leaders and other people, and just trying to just break down those barriers. Well, they didn't let us start that up until the last 2 months, let alone where it should have started in January. So now these people are dying, and we're just saying, well, you didn't get vaccinated. You know what? It's a hell of a lot more complicated than purely a choice. It's a lot more complicated. It goes back to so many different things that, start accepting the blame. The leaders of our state need to understand that now the vaccine program's starting to get a little more robust, but guess what? You have to accept some of the blame for where we are. Guess what? Delta, I've sat on your show, everybody else sat on your show. We watched it across. We watched it go from India to the UK coming across. We knew it was coming. We didn't prepare. We didn't prepare at all. Is there any, oh, we're sorry, we got caught? Oh no, everybody else in the country did. So, we're just like everybody else. So no, Delta is just taken over. People are dying all over the place, but yeah, whatever. It's Delta, whatever. No, you failed us. Okay. You failed us, right? That's leadership. And now we're in the same position where we had our kids get pushed back to school, which I love in-person learning. I really, really, really want our kids to learn in person. But we didn't have anything prepared. We waited till, we got a program out, which was a good program. And I will be the first to say what was written was great, but it needed about a month to be implemented. And now we're putting our kids at risk. And then our kids and it's spreading like wildfire through that age group. And again, I'll be the first one to challenge the head of the DOE. He has no idea how many kids are spreading it at school. I don't have any idea. No one has any idea, just like we don't have any idea of the tourists. But you know what we do know? The kids are exponentially raising in our state with the amount of COVID that is present. Therefore, it is exponentially present in our schools, and we are doing very little to no testing. So we really have no idea, except the school kids are at risk, our schools are outdated, and they haven't had time to prepare. So,
Doc, the kids weren't getting sick when school was out of session.
yeah.
I mean, you don't need to be a freaking rocket scientist to realize this is what pisses me off. Okay, I mean, we use the schools, and when you use safe travel, right? When you use that two specific programs. Safe travels, right? No, it's not the tourists. It's not the, again, it's safe travel. We're not talking about tourists. We're talking about travelers, local residents, and visitors. Our numbers went through the roof once we lifted safe travel requirements. Once we lifted the testing and the quarantine requirements, the freaking cases went through the roof. So you cannot tell me that travel is not part of the problem. Schools, until we opened up schools, we didn't have this 25% of the cases are kids. That happened after we opened schools. So what does that tell you? If not for opening schools, our kids wouldn't have 25% of the cases. So how stupid can these people be? The DOE guy, I don't know him, I never met him, but he reads a freaking script that was written to him, written for him by somebody in the governor's office. I watch this, I feel sorry for him because he cannot be that stupid. He seriously cannot be that stupid to sit and tell everybody, oh, it's perfectly fine. It's safe. Brother, you get an education or you just an ignorant idiot? I don't know. Safe travels in schools clearly tells you that if you don't make changes, if you keep running with these programs, your number is going to continue to rise. That's been proven time and time again. I understand people want their kids in school, of course, but it's dangerous. If it's sharks at the beach, what do? You put up signs, you make sure the kids don't go in the water. Well, the shark is COVID and it's in the school. Sorry for my vent.
Dr. Akiona might come on, my Big Island sidekick, she's watching and she's texting me with like, hey, what about this? And hey, what about this? But she's so fiery. But one of the things she just texted me, but you might see I sent her, I said, hey, come on, man. There was a modeling study that was done. This was on CNN. And the modeling study in schools showed that if there is no masking or no testing, at least 75% of all the kids over a period of 3 months will become stricken with COVID. Then the next breakdown is if there is only masking, 24 to 50% will become positive. If there is masking and testing, 13 to 22%. So even with gold standard methods, you're still going to get 25% of, what do we have? Is it 160,000 kids in school, right? 160? Yeah. So we do that math. Holy shit, that's 40,000 kids that are going to get infected, right? That's like, give me a break. Give me a break. And we're not even doing testing. That if you look at that data, half of them are going to become positive. And guess what? Once again, I'm not sitting here like with a little crystal ball beside me. I'm looking across the South, across like 20 different states in the United States where this data is readily available right now. It's just proof positive. You just don't have to, say, well, where are you getting at, doc? It's like, just go look at all the pediatric ICUs, go look at all the schools, go look at all the positivity, and you got the crazies in the South with the no mask mandates. It's going rampant, and we have kids that are dying, and the kids are on ventilators. It's there. We know what's going to happen. That's just how you do the calculations. You look at all the other states, and then the other thing is we look at the UK right now, which was used as a model to say, well, it's going to filter down. Well, guess what? The UK is starting to get another surge. And why is the UK pointing that they have another surge? Kids in school. Okay. There's another very, it's a very good comparison to follow what's going on in the UK because, we have good health systems, we live in the same settings. There's a lot of comparisons to our economic status, the way we live. And that's why that's something that we study because they're doing a lot more testing than we're doing. They're doing a lot more analytics. They're doing a lot more genetic variant analysis. They're actually doing a better job than we are. They're blowing our CDC out of the water. And so every indicator says it is going to run rampant through our children. There is zero, not 5%, 10%. There is zero that is basically to say that we will not follow the same fate. Zero. So, and someone says, I think he said, oh, we have mitigation strategies. You know, they're winging it when it comes to that. They were just the poor principals and the poor teachers and the poor superintendents. They've all been freaking just thrown to the wolves, and they've been given a plan 5 days before they were starting, and then they're told to implement it. I don't fault them at all. I mean, I don't fault them at all. The teachers are God sent, and the principals are just probably just up the same time I'm up every night at 3, and just worrying. And you can see, just well, ask our viewers how many of them have had notes coming home to their kids that show that, hey, you have a positive in this grade and positive in this grade and positive in this grade. I mean, we have them just flying everywhere here on Oahu. So
their mitigation strategy was buying 3 containers and converting them into mobile marts. That's their mitigation strategy. I think that's an embarrassment. That's appalling. You know, they're just so reactionary. It's disgusting that they're not looking at how we're going to stop the virus. Yeah, because we got to be concerned about the visit industry. We cannot really hurt the visit industry. We cannot inconvenience the visitors. We don't want to piss them off. We don't want to piss off HLTA and HTA. No, because well, let's just let the locals suffer. Let's put the locals on a lockdown. I did want to ask about the 3-day. What this 72-hour deal that the lieutenant governor is proposing? What the hell? What the hell is a 72-hour deal? Aside from being punitive on the local residents, there's no real medical benefit when our cases are growing exponentially. If you're only gonna, and they're still gonna gather. It's not like the party's gonna stop.
Well, that's the thing that I would look at is, we all know the reality is that people are going to pile on in their garage, and they're going to have their friends over, and they're going to be in their backyard, and they're going to be there, and they're going to probably be hidden a little bit more. I think some people will back down, right? I do think some people will be really concerned and back down. But by and large, I think that the strategy is that there's this look back period that is saying that that if you look post holidays, that we had little bumps that had occurred, right? And that those bumps then led us to some of the positive surges that we had, and they're just trying to prevent those positive surges since we have community spread. So, I mean, theoretically, it makes sense, right? I mean, theoretically, it does, that to say that if all of us did equivalent of a stay-at-home order for the long holiday weekend and we didn't do anything, there would be a little bump down, versus if we just partied as normal, there would be a bump up. Yeah, it makes sense. But the question is compliance, right? Will anybody do it? The second issue is enforcement. I mean, you want to talk about garbage, and I'm not blaming any of our agencies, right? I'm not blaming the DLNR or the police forces or something like that. But it has been Gina Mangieri's report. I'm sure you guys saw that, her analytics. It was a well done report, and it was just black and white. There is nothing in the way of enforcement, absolutely nothing. And so everybody knows that. So therefore, if you're someone who's saying, screw it, you're still going to go out and party, so it's not going to be a big effect. And then, of course, well, tourists are exempt. They're all exempt. They'll all be all over the place and exempt. So,
yeah, I guess my biggest concern is, so you get a stay at home, a pause, and then what happens from Tuesday going forward? I mean, again, we've gone beyond the line. If we had put in these pauses 3 weeks ago, 4 weeks ago, 5 weeks ago, we wouldn't be at the crisis level in hospitals. We have not. If we had a sustained stay at home or a sustained pause. But a 3-day pause, it's like a fire. If a fire is going out and you send out, hey, you know what, guys, we're gonna send out only 2 fire trucks to put them out. You know, we're gonna pause the rest of the trucks. Just, yeah, you're gonna slow down the fire a little bit, but you're not gonna stop them.
Yeah.
And the fire will grow after 3 days. So I just don't get it. I think it's where they feel like they gotta do something because the public is yelling and screaming and doctors and experts are screaming. So they come up with a little crumb of 3-day, like that's gonna make any big difference. I think all the experts, including the Department of Health Director, Libby Char, said you gotta lock it down for what did she say, 28 days? I think is what she said.
Yeah.
To have any impact on the surge, you gotta do it for 28 days.
Let me just throw this out. Here's another one. I'm sorry, you guys are this is a therapy session for me. You can tell I'm actually, again, I'm fired up tonight because I just have just so beside myself with watching all of this. And you know, today is a day when 13 deaths are announced, and you look at those ages and you look at all those, and I just think of those families. And you know, as a doctor, you live with death, and you have to put your pen onto a death certificate, and you have to be calling a family and offering condolences, whether it's a cancer or a heart attack. And you, just because you're close to these people, it's real. It's real. And in our state, with a true sense of ohana, so many people were affected by it. So that's one of the reasons I'm just so like frustrated, and because there will be more death, unfortunately, and it's going to continue on and on and on and on, because it's already projected with our numbers. You know, we're being told the data to expect. But let me just throw this out to you. So if I would have said to you 4 to 6 months ago, 4 months ago, after we've always been told hospital and ICU are our barometers, and I would have said to you 4 to 6 months ago, all right, what kind of status will our state be in if we're basically at 120% of ICU capacity on the neighbor islands, and our Queens ICU is full and everybody's full, and our second largest facility in the state, serving a very, very significant portion of the island of Oahu, goes on emergency crisis lockdown and has to stop accepting patients. And we have to start having tents set up on all the grounds of all the hospitals. And we have to have a warning that we have to ration oxygen, that we're running low on oxygen. And we have to order 3 morgue trucks in, okay? Now we could put some more ands in there, but just put those pieces together. Wouldn't we say, no frickin' way, not in our state, not in the United States of America, that's not gonna happen. No way. No, we've been promised by our leadership that, oh, we're going to watch hospital capacity is good. We're going to watch that. And now we're sitting here in the third world, just with freaking tents and rationing oxygen and refrigerator morgues, no plan in play whatsoever to stop anything. No definitive word except saying, please don't come to tourism. Nothing, right? Haven't really pushed our testing up, haven't put any crises management into play. We don't have the Diamond Head crater open, and we don't have the meetings of the governor. Is, you know, he's going to go out and enjoy his 3-day weekend this weekend or something. But is there any crises as people are dying? Is there any push for emergency management meetings where there's a resolution where we're looked at and we're being told, this, and this is how we're going to solve this, and this, and this is your responsibility, and we, as your government, are going to do these things for you and fix this. If anybody can spell me those out, please do, man. I've been waiting for them for 3 months, but Nothing. We're working on it. We're working on it. We're checking on it. We're working on it. Right?
Monitoring.
Monitoring. Right.
Monitoring.
What the hell? What the hell? 13 deaths, and we're sitting here, and what are we going to get tomorrow? We're going to get a nice, soft little press conference to say, well, we really want you to try to stay home this weekend. What? No. Give us a plan. Do something to give us some leadership. Give us a plan. Give us a definitive plan so that you can look at us and tell us in 6 weeks, our hospitals are going to be safe again, and we're going to have enough oxygen, and the morgue trucks are going to be to store ice cream, right? Don't tell us we're going to be filling them up with bodies. So,
yeah, it's shameful. It really is shameful. And the fact that they are waiting for the hospitals to get beyond full. We're already there, but they keep setting the number, like Charlie said earlier. They keep moving the goalposts. Oh, 500. What? Why aren't we trying to get the number dropped to 100? Why aren't we doing things to reduce the capacity, or not the capacity, but the numbers of people in the hospital? In other words, get more people released from the hospital quicker than we can fill them up, which is not happening right now. So it's,
let me throw something out that doesn't get talked about also. All right. And again, you guys got me here because I'm a 30-some year active physician, with a group that I run here in the state. There is so much other pain and suffering being caused by this lack of leadership. But is anybody going to look in there and apologize? Because guess what? All the elective surgeries are all canceled. So the tourists can come, right? And so we can, quote unquote, keep it. But you know what? If you're about to have a knee replacement, or you had a major joint problem, or you've heard the story over and over again about the poor woman that's been diagnosed with breast cancer and then has to wait and sit home and psychologically be suffering, knowing that you have cancer, but you can't have surgery. And that goes on, colon cancer, I can name your lungs, etc. And is anybody, if it takes another month before these surgeries can happen, is anybody going to say sorry when the cancer is spread to another part of your body and now your life is shortened? Because we took care of tourism. Yeah, we took care of tourism. We kept our restaurants, everybody happy. But you know what? And then I can tell you, no one talks about healthcare as a business, because, my businesses, the surgeons, devastated. All of the healthcare industry outside of the hospitals. The hospitals, are flowing with all the government money coming in. But if you take the 55% of the state medical infrastructure, which is solo doctors, ones and twos, and the surgeons and the specialists, devastated. People have left the state. They've gone out of business. People's incomes have dropped. And I know no one gives a shit about how much money a doctor makes, but basically to practice in the state of Hawaii is a struggle. It's a struggle, and we know how short we were of physicians. And like when you shut down the same day surgery, besides the struggling doctors, the people working those, all those, they're out, they're kind of out of business, because how's a surgeon survive? He does surgeries, right? Large number of the surgeries are all elective surgeries. You plan on them. A lot of them are cancer surgery, but they're not happening. And I can tell you, there's a hell of a lot more GDP that is going down the tubes with that than there is if Zippy's is still selling chili right now for a month. So there's a whole nother side, the pain and suffering to the people of Hawaii who can't get the access to regular healthcare, because the only thing that's going on in healthcare, whether it's your CAT scans or everything, it's all geared towards COVID. Does anybody talk about that? No, no, nothing, nothing. So if you're out there suffering, you know where to turn and who to blame for it, because basically it's because you are, being treated as second in this whole process. So,
I know a lot of people talk about the devastation of a lockdown or a shutdown or stay at home for a month. But listen, people, it's inevitable. A lockdown is inevitable. And if we can get by with a 28-day lockdown now, and it may happen every so often. If we cannot get a handle on this virus, maybe we'll have a 28-day pause every 3 or 4 months. There's no way around it, but we cannot continue to let people die. That's what gets me. It's like it's double digits now. Now it's double digits. Are they waiting for triple digits? So I understand the economic side of this thing, but at some point, people gotta. I hate to say it, but take one for the team and say, hey, for the betterment of everyone, we got to do this. And I know it's hard if you're in that industry, and I can only imagine what it's like. But at the same time, golly, how do you explain to a family of someone that just died from COVID and say, your family member didn't die in vain because we kept tourism going. So know that her passing really kept a lot of people at work. I mean, that's just totally not the right thing.
let me answer some of those people, because I don't want to sound like I'm not being sensitive, because I have so many friends, I have so many patients and family members of friends that are working in the industry, both restaurant and tourism, or affiliated, that are dependent on it. Even some of the shop owners that, their shops are dependent on getting the tourism business from coming. Yeah, we know what it is. But see, we're looking forward. I'm looking forward. I'm studying what went on in the world. I'm looking at where we are. I'm looking at how poorly our government handled our last shutdown. They let it go on way, way too long and didn't do anything in the interim. And that's why we had so much pain in it. And I know the disease. And I've said this on this show before. If we shut down for 28 days, knowing the cycles of the disease, and we have a work at home order, restaurants can do takeout, and the only thing that's going to happen is we're going to just lock down the tourism. We're going to lock down the businesses. You're not going to go into the office, and you're just not going to be going out. You should be able to go for a walk in the yard. You should be able to walk in the beach. Because those are all safe activities outside. We'll see a 75% reduction. Now, guess what? We then go to the world and say, hey, world, Hawaii, we're just like everybody. Delta came here, but we kicked its ass. We did the right thing. We stopped. We put these programs in play. You are going to have to get a test when you come in. And you know what? All of our restaurant workers and all our hotels and all our shops have these new and improved safety, because we took this month to clean up, to make sure that since Delta had changed the way we addressed it, now you come back because we are the safest place again for you to come back to. Welcome. But no, what are we doing? We're seeing this trickle down. How do we turn it back on? Is anybody going to believe us? They're going to say, what you do? So for all those people who are out there saying, no, we can't do it, what I think we're trying to say is that because of the lack of leadership, the lack of definitive planning to do anything, this has a chance to be very protracted, to go on well beyond anything that we would want it to be, well into the beginning of the high end of tourism season, and turn into a long-term downturn. That's not what we want. We want to get in, fix it, do it, and then turn it back on, right? We know we can do it. We proved we can do it as a state. And if we go in and we do 4 weeks and we get our act together and have a cohesive plan by true emergency management leadership at the state that would be put into play and let do their job, we would kick ass. And we would come back right in the middle of October when we're about to look at the November, December winter season, and would be able to turn our lights on and say, hey, come on, man. You know, the rest of those people don't have their act together, but we do. You know, that's what's really also frustrating me is I don't think we have any way or plan that's going to rejuvenate this because we've done it so poorly. What do you guys think of that? I mean, you think I'm nuts.
No, no, I think you're right on target. You know, listen, the people have sacrificed for a long time. The government, you know, because I see comments about, you know, people gonna lose their house if we lock down for 28 days. Well, you know, the government cannot let that happen. Plain and simple. They have a lot of programs right now. They have a lot of programs, rental assistance, all these different types of assistance that's available, and people need to take advantage of that. And for those that don't qualify, whatever the case may be, the government, again, this we can do it now or pay later. That's kind of what it boils down to. That's what it boils down to. Again, the stay at home would be just like the last one, as you said, Doc. People still be able to go out and grab their meal. The restaurants could still function. No in dining. I mean, but that's it. So I understand. The thing is, they're doing nothing to curb the surge. That's, I think, what pisses me off. They're doing absolutely nothing other than ram vaccinations down people's throat. That alone is not going to solve the problem. So,
Yeah, and I agree. And then the other thing, that's the final thing I wanted to add, is you would come in. I mean, today's papers were blaring that what's Oahu and Mayor Blangiardi going to do with the $326 million in federal money that we have sitting around, right? Like, and then we have a how many billion dollar surplus now. What freaking state can be saying they have this massive surplus because we squirreled all this money away? Use it, give it back to the people. It's your money anyways, right? It's all our taxpayer monies anyways. For 28 days, we should be able to send everybody a freaking nice sized check to keep them alive. They're going to get 67% of their wages by unemployment, right? You know, that's what happens. You go on unemployment at 67% of your wages, and then get some other monies coming from all the surpluses that are coming through. That's what it's there for. You know, so but no one's talking about that. You know, why do we have all that money squirreled away? You know, when now is when people need it, and now is when the state needs it to help the people of Hawaii. So I don't know. It sounds like
no,
I'm not looking at the speech. It sounds like I'm making enemies tonight. So
no. I think you know, there's valid points being made, but the bottom line is it's clear that this state is not concerned about the health and safety of the residents. That's kind of where it boils down to. I would really love to see what I haven't seen, and it's kind of frustrating. I haven't seen the legislature like they did last year with the Senate COVID committee with our good friends come out and really hold these people their feet to the fire. I haven't heard. I saw the Honolulu City Council do a resolution urging the state to really increase testing and hit back the safe travels testing. But I haven't heard from any other county. So it's frustrating that the people are all screaming. Our representatives are quiet. All of our representatives, whether it's at the local level, state level, are quiet. They're silent. And I think that's what's causing a lot of the frustration as well. It is for me, because I expect them to be speaking for us. And I just don't see it happening right now.
okay, so let me ask you, this is another one of these sleepless things I wake up with. I'm a huge believer that we are the greatest country in the world and we're the greatest democracy in the world. And part of being the greatest democracy in the world is we have a balance of power between the legislative, the executive, and the judicial branch. So right now we're seeing utter failure of the executive branch, right? So you would hope that you would see the judicial branch will step in and kind of push things along to say, hey, we're in a crisis right now. What are you doing? What's your plan? Hello, we got tents and oxygen and more trucks and hospitals are capacity. If we had a strong legislature, they would be sitting up and banging gavels and calling in witnesses and saying, you're thinking about it is not an option. What is the plan? People, we just had 13 people die. What is your plan? But I'm guessing they're all worried about election. They're all worried about fundraising and thinking, well, I don't want to stand up because on one hand, I'll get my donors mad, whether it's the unions or the visitor industry. And is that what it is? I don't know. So what's that leave us? It leaves us the other branch, which is the judicial branch. And I'm just waiting for one of the shoes to fall. We saw Michael Green is going to be suing for the people who don't want to have a vaccine mandate. But the next thing we're probably going to get is somebody suing for the families of the people who are dying for gross negligence. So it's going to go into the judicial branch. And we know what that does. That goes on forever, and that turns into a big mess. But we know our executive branch is failing us. And I do think we all have to be very disappointed in our legislative branch for not stepping up and holding more hearings, having more accountability, and demanding answers. So.
Yeah, I think you said it right. Election year coming up. They can either piss off the people who tend to give small donations or piss off the big money people. And it's sad. I saw in the news that they went down, one of the Senate committees went down to go, I guess, take a look at the new UH football field, and they were just all excited. I wish they would go to the schools. I wish they would go to the hospitals. I wish they would go and see where the people are getting sick and dying, and go look at what's really important. I love football. There's no bigger football fan than me. But when we're dealing with a virus like COVID, I think maybe the football field could have waited. Those are the kinds of monies that should be going to the people that maybe are put out of work because of a lockdown. But anyway, that's just my humble opinion. Man, we went way beyond time, Doc. Appreciate you staying on.
Oh, geez, I didn't even look at the time. I'm sorry, Doctor. I was telling Dr. Akiona to join me, and she was like, "No, I just want to listen. You're doing good." And so, but yeah, well, you guys can get her on sometime by herself because she could talk to you at length about a lot of things that are going on, both on the big one and in other areas. But yeah, guys, I'm sorry, and to the viewers, sorry, I'm on a. This is really hard for me. It's really, really hard for me when you know the answer, and it's so self-evident, and it's not all that hard, to be honest with you. And I'm not talking about the lockdown. I'm talking about what we were trying to do before, when we were trying to prevent the lockdown. For the viewers that are not hearing and haven't seen the stories we've been doing, we've been talking for months about how to prevent from getting in this situation. Didn't even happen. No one even listened. Didn't even happen. So now we're where we're in the third world kingdom of Hawaii right now, of tents and hospitals and oxygen and people and no plan. We're out of options. That's what we're trying to say to the people. We're out of options right now. That's why this. And so now let's stop the bleed. Let's get it done. Let's save lives. It's the number one thing. Why? What do I want to do? Save lives. Save lives. So anyways.
Thank you. Charlie?
No, have a nice evening. Thank you.
When I come on, you guys don't get a chance to talk because all I do is rant. So
I just want to say, Dr. Kapono Chung Hansen emailed us today. They sent a letter. It was signed by Dr. Kapono Chung Hansen, Dr. Lee Evslin, Dr. Lee Lee Altenberg, sent a letter to the governor, as well as all the mayors, Senate President, House Speaker, representatives, councils, DOH, superintendent of the DOE, district health directors, complex superintendents, and a shitload of people. They haven't gotten a response yet as of 4:30 this afternoon, but they're actually asking, begging about the stay at home, that we need this. Anyway, they'll be on tomorrow night. So tomorrow night we have Dr. Capono, Chong Hansen, Dr. Lee Altenberg, and Dr. Lee Enslin will be on tomorrow night at 7. And then on Friday, we have Dr. Jerome Kim to give us the updates on all the vaccine questions you may have and all of that. So exciting rest of the week. It'll be a fun week.
Boy, I'm gonna tune into that tomorrow. That's for sure, because those are all
should be interesting.
Yeah, those are great people, and they have no. What the people also have to understand is those three guys. They have no ulterior motives except for helping the people that rely on them. Crazy.
That's what separates you guys from all the rest. You know, there's no agenda other than, like you said, to save lives. So we're looking forward to that. This week will be a good week. All right, everybody, you guys take care, stay safe, God bless. We love you guys.
Hang in there, guys.
All right, button here. Yeah, everybody hang in there. Stay safe, guys.